We are in conversation with Dr. Ramanan Laximinarayan. He is the founder and director of the Center for Disease Dynamics, Economics and Policy, the CDDEP, in Washington and New Delhi. A senior research scholar at Princeton University and an affiliate professor at the University of Washington. He's someone who's been doing tremendous work on the epidemiological point of view right from early 2020. With so much of information going around about COVID-19, you have been a calm voice of reason and science through the pandemic, Doc. Welcome, Dr. Ramanan, and thank you for joining us. To take this conversation forward, I welcome Maloo Natarajan. How do you introduce someone who is known to everyone at FLO? Maloo, Immediate Past Chairperson, mentor, friend, prolific banker, and someone who leads with charisma and has a subtle sense of humor. Before we dive into the conversation, I would like to express my thanks to Monisha, without whom this event would not have been possible. Thank you, Monisha. Over to you, Maloo.
Thank you very much, Lubena, and good evening, everyone. COVID-19, at least 50% of us in this session today have been a victim, and yet it is still a mystery to all of us. We never stepped out, and yet it caught us, is a commonly used phrase. We hope to get answers to most of these by the end of the session. As we sit in front of our screens, cribbing about being forcefully confined to our home because of the pandemic, there are heroes who have been fighting out there with the brightest smiles on their faces. Our heroes are not the ones who have superpowers, but the ones who, without any power, are out there helping us on a daily basis. All the doctors, nurses, delivery people, and everyone who are helping us during this time need a special round of applause. We are privileged to have one such hero amongst us today, Dr. Ramanan Laximinarayan. Dr. Ramanan, I would like to start by thanking you for helping India breathe again. Even in our wildest dreams, we never expected to experience a situation when O2, which is the only thing that is free and available in abundance, will not be available for a price. I would like to ask you to talk to us about your venture, Oxygen for India. I did hear that you started this when a friend of yours could not get oxygen on time, and I'm hoping that your friend is much better today. So over to you, Dr. Ramanan.
Thanks, Maloo. So I'm a researcher, and I've been working on COVID since the early days because I work in infectious disease epidemiology, and this is primarily the sort of things that we've been warning the world about for many years. This is what we spend many meetings and conferences on. But when it finally happens, then people, of course, are surprised by how it really, panned out this way. But it was no surprise, and I think, way back last February and March, we were warning people about how this was going to be a tsunami and hit unless there was a lockdown. And of course, there was a lockdown. It was not, I was surprised a little bit that the government acted promptly, but it was good that it happened because the lockdown helped prevent what we are seeing today. It is because of the lockdown that we didn't see this kind of huge wave last year, because the only information you need to be able to predict what happens with COVID
should be universal. They should be universal rights and through the cost.
Can we ask everyone to mute, please?
So the only thing you need to know about COVID is very simple. It is that it is a novel disease, the likes of which the world has not seen possibly for a few centuries even. The only predecessor to it that is comparable is SARS-CoV-1, which came out in 2002 but quickly died out for reasons we don't understand at all. And fortunately it was confined to just a few countries. India was not affected that time around, although I did lose a close friend to SARS-CoV-1 as well. The total death toll was about 1,000 people, and about 10,000 people were infected. This time, of course, it got out of hand, and it was out of hand by January itself, and which is why the advice to the government and everyone else was, be prepared for something very big. And initially there was skepticism, but finally, some wiser heads prevailed inside, and they put the lockdown in place. But I think come January, there was a sense that it was over, and I'm often asked the question of when is the wave going to peak, what's going to happen? And these are questions that are, I think there's still some feedback here. I don't know. I'll unmute myself. Yeah, I'll unmute myself. So, the answer to this question is very simple. The virus is not like an asteroid hit on the Earth, right? So if an asteroid is heading towards the Earth and you asked a physicist how long will it take to hit the Earth, it's pretty easy to calculate. Now with viruses, the main determinant of how these waves happen is really human behavior. That's the main determinant. If we stay indoors, this wave will be over in no time. If we don't stay indoors and we don't mask ourselves, it will take forever. So in the initial predictions, it was easy to predict what will happen to the country if there was no lockdown. It was harder to predict what will happen under lockdown because then you don't know exactly how the virus is getting affected by this. Similarly, what happened was in January, there was a sense that this was all over. And I myself thought that the government would never let this out of control again because everyone had learned what a serious threat it was. We've seen what's happened in New York and everywhere else. And this would be controlled the next time around, and there was adequate preparation. And we were constantly told there's adequate preparation. We were told about, railway carriages that are COVID hospitals, how oxygen would be airlifted. Everything was ready for it. But come March, I was shocked that none of that preparation had actually happened. And it was very acute for me when the CFO at a startup that I had founded, he was basically 2 days after getting COVID, 42 years old. He has a 5-year-old daughter. He had difficulty finding oxygen, and his wife called me in the middle of the night at 3 a.m. and I happened to be up, and she said, I can't get oxygen for Rahul, and so then my entire team started working on this, and we found that we had to source oxygen from very far away. We had to get it from Moradabad first, then from Haridwar, then we had to send someone to Sonipat. It was hours, and even there that person would have to stand in line for 24 hours. And this is despite us having great connections. There's no shortage of connections that we would have. And I thought that if we have difficulty sourcing oxygen, imagine what someone who has no connections would be able to do. And that's why we started Oxygen for India. We started small and we thought, okay, we'll raise $100,000 and we'll try to see if we can solve the problem locally. This was all the aspiration was. Now, of course, when we built a model and a bigger team came in place, and we started fundraising in the US because my nonprofit in the US started taking in funds. This grew very fast. We had Verizon Media sign on. This is Yahoo, Logitech, UiPath, which is a big company there, Tech Mahindra here. And this is today, after about 10 days, we raised about $10 million. So we went from literally that to 10 million just in about 11 or 12 days. And I don't think that's so much a testament to our fundraising capability as much as the fact that this is a crisis. And of course, we work in this space, so there was some credibility there, and these are CEOs that we know quite well. But, this problem has continued. Rahul, despite our best efforts, the oxygen was choked off for him almost every night, and his SpO2 will fall to 70, 75 just because the oxygen in the hospital was not a reliable source. And even though we could supplement it at various times, we could only get him about 30 liters a day, one of the 30-liter canisters. And he probably needed 2x of that. He was on high flow. On top of that, there's a lot of irrational treatment, which I don't want to get into. There's a lot of irrational treatment which is driven by poor science and poor direction from the very top here. And I can share with you on the link, and so I don't want to basically Rahul passed away 2 nights ago, and he passed away, and it was very sad because he had everybody working for him, cheering him on. He was a wonderful person, a really wonderful human being. He was 42, and I just couldn't face his wife. It was just so hard because this is, and the worst part is his brother was in the ICU bed right next to him. And so I was at the hospital, and only his wife was there. They don't have any male members of their family, and her sister was there, and that was it. Just her and sister and myself. And this was at 10 at night. And you guys can, to see how it happened to be the case that maybe it's on YouTube, but I'll show it to you on CBS News. I happened to be shooting a segment for CBS News at the time when I got the call, and this segment was, I was actually just outside a patient's home where we'd gone to deliver oxygen because the camera crew wanted to shoot that. And that oxygen had just arrived, that OC had just arrived 24 hours before into Delhi airport, flown in by United free of cost. Everyone has worked hard at it. It came from a firm in Milwaukee where people have been working, round the clock to make it happen. So many people made it happen to get it to that one lady, and you can see that in the news clip. And of course, when the news arrived, they shot that as well, and they put that in the segment with Rahul's family's permission. And this is what was watched by millions of people yesterday in the morning in the US. But the saddest thing is it didn't have to happen at all. He just did not deserve to die. And he was a guy who was very careful, extremely careful, but it was a system that let him down. I mean, oxygen is so cheap. To fill a tank of oxygen, a 15, 20 liter tank, at normal times it cost us 50 rupees. So you're talking of an intervention that costs 100 rupees a day, which he would have needed over 10 days, 1,000 rupees max. And this guy who is not, who had all the connects in the world, 1,000 rupee investment was not available to him when he needed. Now, it's small. So of course his brother now is also critical. Finally his family let me move him out, so we got him into Medanta, and he's more stable now, although he's not out of the woods. And at his cremation, at Rahul's cremation, which is when I saw his father, his father said, please don't let both my sons die the same week. I can't take it. And I said, listen, we'll do our very best. And we took, my team moved him out. Meanwhile, there's a large army of volunteers and other people working on Oxygen for India, which is about 150 people if you count around the globe. There's everybody involved. There's Amazon Logistics. There's United Teams out of Chicago and Colorado. There's the supplier. There are people on the ground in China. I can't tell you the numbers of people who work at it to make all this stuff, this machinery happen. And of course, people on the ground in 8 cities preparing for things, my own procurement guys. So most of these people have not slept, and I include the US people, they've not slept in literally the last 2 weeks. But we weren't able to save Rahul, but I hope we'll save, a few other people.
Sorry to hear that, Dr. Ramanan. And, it's very appreciative what you're doing, and a lot of heroes like you. But this is the last mile delivery that is a problem today. So it's more of an infrastructure. How is the government helping you, and how do we make it into a more sustainable process going forward?
Well, as you know, we can expect no help from government, nor do we expect it. So government should have solved it a long time ago. They just have not, and they're not. This is not. If they've not done it in response to COVID, when will they ever do it? So our vision is, and we're working with large partners like Give India and so forth. And the reason I want to talk to your group is, many of you are either in positions of power or have families that are positions of being able to give. And I'll tell you something, one thing I should say I'm very disappointed by is that the amount of money we've raised in the States is about 20 times what we've raised in India. And, I'll read out what one of a colleague from the US, from Angola, it's a good friend of mine, and that's what, he wrote, and I have to read this out to you guys, because he said, Professor, there are some things that are hard for me to understand about the Indian situation today and donations. We know that some of the biggest companies in the world are Indian, like Tata and Adani and Ambani, and you need to cry for help from the outside. The India problem is not about money at all. For me, it's all about how society classifies people. If you don't respect and love your own people, there is no money that will solve those issues. I hope a lesson can be learned from this tragedy and help create a new society. I can't disagree with that. We are not generous ourselves here, and we go out and look for help from other places. And why should we? India could have solved this problem so easily. What's $100 million? It's chump change for this country, right? We talk about Atmanirbharta and all this stuff, which is why I talk about government is not going to solve the problem. Yes, we'll put in place a national oxygen grid, and using these donor funds and working with others, we will try to make sure, our goal now is to make sure that nobody dies because of lack of medical oxygen again. And remember, medical oxygen is one of the most critical interventions or inputs into health no matter what. You need it during childbirth, you need it during pneumonia, you need it during pretty much everything. I mean, it's one of the oldest things that people in medicine knew, that delivering oxygen would be something that you could help someone with. And if in the 21st century, a country that sends spacecraft to Mars can't solve a simple thing like this, what are we really talking about? So I think we really need to listen to what this African guy said and see, where is our generosity, where's our ability to raise the money, where is our response to the problem? And frankly, why is someone like me, who's a researcher who should be studying COVID, and that's what I do, why am I solving this problem at all? I'm doing it because nobody else is, but this is not really, this is what FICCI ought to be doing, or I see whatever, all of these other institutions, really, ASO chairman, all these guys should be doing, or the government should be doing. But we don't really value each other in the society in that same way, and that's really what's most disappointing to me in a sense. The problem would be solved, but because we're really raising a huge amount of money from the US, and that's just the bluntest way to put it. It's not because India is solving this problem.
Yeah. FLO has a database of 8,000 women, and Lubaina has shared the link. So I'm sure we will definitely help out. And going forward, we will partner and see what best we can do about it.
Maybe FLO should take it on as a mission and say, we will make sure that at least say, the number of women I know who've died in childbirth because of COVID. My maid sister died because of childbirth in somewhere, some village outside of Darjeeling, because she had COVID. I mean, where are we helping our own people? I mean, I don't think we can get to Darjeeling or the outskirts of it, but the fact is that these are things that we just have to take seriously and solve for ourselves. And I would say if FLO says, listen, we are going to figure out a way to make sure that nobody, at least even if you pick women in childbirth, pick that part and say nobody dies in childbirth because of lack of medical oxygen, you would have done so much good. So I would urge you to go for something ambitious like that. And the number of children we lose to pneumonia, we lose about 200,000 children every year. Now, every one of them is precious to some set of parents or some mother who gave birth to them. Some child under the age of 5. We've got vaccination, but we still lose almost 200,000 children. Many of them could be saved either with penicillin or, and/or with oxygen. We just don't have it.
Point noted. We definitely will work on this, and we'll see if we can do it nationally as well. Thank you so much for that. You have been talking a lot about the concept of human behavior as one of the most important determinants on how infectious diseases evolve. You mentioned this today as well. So have the Indians understood the concept? And is it because of lack of understanding that we are unable to implement some of the things that needs to be implemented ASAP?
I don't think that's just Indians. That is people everywhere. And the thing about COVID and generally infections is that people always think, oh, that is happening there, that's not going to happen to me here. That sense of exceptionalism is not uniquely Indian. It's true everywhere. When it's happening in China, the Italians thought it's happening there, it's not going to happen to me. When it's happening in Italy, the Brits thought that's an Italian problem, they're Mediterranean, they're dirty, it won't happen here. Then when it's happening in Europe, the Americans thought this is only a European and Chinese problem, not our problem. And India was meanwhile spinning its own stories. If you go back and look on social media back then, if you remember, all these stories about we have BCG, we have heat, we eat healthy food, we are not obese. I don't know. I mean, the number of, we have higher levels of immunity, we eat Chavanprash. I mean, I don't know. It's an entire exceptionalism story that is spun about why Indians are not, susceptible to COVID. And, how much more can you say, which is that actually everyone is susceptible to COVID because it's a novel virus. And actually human beings are not very different from each other. We're all 99.99% the same, right? Because we're 99% the same as chimpanzees. So between us, we're actually more similar than we are to chimpanzees, hopefully. And so we're very, very similar. And this is a completely novel virus. So the main thing that shapes what happens is really this behavioral part. And this behavioral part is really the part that is hard to get people to pay attention to. Even today, actually when the CBS crew was shooting, they took a break and we went to get a drink at McDonald's. And I told the parking lot guy, "Aap mask kyun pehne rahe ho?" He's saying, "ये COVID ऐसे कुछ नहीं है, सिर्फ बेवकूफ बना रहे हैं हमको." because that guy's never seen what, if he were to fall ill, he would be dead because there's no hospital for him or no oxygen for that guy. But, partly it is also lack of education, lack of knowledge, whatever it may be. WhatsApp and misinformation causes a lot of, challenges. And at the end of the day, there is only one thing, which is vaccination. You're going to get out of COVID in two ways. You either suffer through the disease and you live, or you're going to get vaccinated. There is no other thing.
Have you seen an improvement when it comes to these behaviors over the last 1 year, or has it been?
It comes in waves. So when I go out for a walk, I go once a day, and now everyone is wearing a mask. So you have to remember the logic of why we had to put in place a lockdown, right? If some of you remember, I very strongly argued for a lockdown March 19th and 20th, and this was not just outside, inside government as well. Why? Because behaviorally, you need a lockdown, because if you just tell people for a disease that has killed, 10 people and has caused 500 cases that everybody should enforce masking and social distancing, they laugh at you in a country of 1.4 billion, right? And they did, by the way, they did. So it was very important to enforce it through law and order at a time like that, because then you needed the cops out to make it happen that way. Now you don't need the cops out. There are no cops outside here in Delhi, but everyone is wearing a mask. Why? Because generally people know that if you don't wear a mask, you're going to end up in hospital, sooner or later. So you need the enforcement when people don't recognize the seriousness of the disease themselves. But when they recognize it, the enforcement is really not needed as much. But again, that's a full statement, because there are some people who, even if there are thousands of people in hospital, there are people on WhatsApp saying, oh, this is actually not true. It's international media that is just taking cremation grounds and recycling pictures. I mean, what can I say? I'll tell you guys, I've lost many people to COVID, and I've lost people who, WhatsApp me asking for oxygen that we couldn't serve. And then 5 hours later, that person says, their relative says, don't worry, they've died. And these are people at the highest levels of society, former secretaries of government of India, down to, every other person. And I don't mean that in any way. I just mean, it doesn't matter. Power or wealth doesn't save you from this disease. And 3 days ago, I took my driver and we went to Nigambodh Ghat, which is the biggest ghat in Delhi. And I went outside and there was nobody there. Nobody. And there were only 2 ambulances there. Then I thought, this is kind of strange. We're hearing about all this stuff. I've not actually been there, but I had to go see it for myself as someone who works on this. And I went inside. There were no less than 100 burning funeral pyres, 100. And there were only 3 people there. Right? That is the lonely way in which most people go now. And remember, in our society, it doesn't matter by religion or whatever, when you go with your family around you. And that is the saddest thing, which is, in this biggest ghat, there were 3 people who were basically just pouring ghee on the stuff. That's all there is. And so, what can I say? I mean, are we supposed to take everybody to the ghat to show them what the disease does to you? Yesterday, when I was standing outside, day before yesterday night at Rahul's hospital, and 4 other families whose relatives had also passed away that same evening, and had all suffered the same problems. Oxygen had run out, their O2 levels had dropped, and they'd all had heart attacks that same evening. And what could I say? Each of them had lost 2 people, sometimes 3 people in that same family. What can you say to people like this? And then when that is happening, there's a whole bunch of people saying, oh, the government is great. I mean, it's not about government or politics or anything. Of course, I'm upset that, that part of our society did not respond. But at the end of the day, we have to figure out our own behaviors, and we have to figure out how to communicate that. Sorry, it's just been a tough day for me. So yeah, go ahead.
Yeah, sorry about that.
No, sorry, I'm missing.
Maloo, you kind of got lost.
Can you hear me now?
Maloo, I couldn't hear you.
Hello.
Yeah, now I can hear you. Yeah, go ahead.
We lost you for a second.
Okay. The examples that you gave us leads me to the next question. There is a lot being spoken about the physical protection in terms of social distancing, in terms of masks. What about the emotional and mental aspects? You can see that being affecting a lot of us, adults, kids, so, what are we doing to beef this up? Because that is as critical as taking care of your physical needs.
You're absolutely right. And I'm not an expert on this, by the way, so I don't have anything more than a layperson's perspective on this. But, if someone dies of a heart attack or something else, there's not a sense of guilt on the part of people who are left behind, because there is a sense of inevitability that this happened. Or let's say someone died in a plane crash. There's also a sense of inevitability. Here, I've seen people who think that they may have passed it on to their parents, or parents who think they may have passed it on to their children who died. And the sense of guilt that comes with that is enormous. It's enormous. And, obviously you can never comprehensively say that this person gave it to that person or whatever it is. But because of the communicability of this disease, there is a lot of guilt. And I think that we'll all have PTSD for a very long time just because of people we've experienced having the disease or, dying of it. And I don't know of anybody who doesn't have a family member who's not died, either immediate or extended. And I think that's true for all of you as well. And lucky if you haven't, so you're one of the fortunate ones. But you're right. And I don't really know how we're ever going to deal with it, because there's guilt within ourselves. There's a sense of, with this particular, one of the guys I was talking to, I said, was your father vaccinated? He said, no. And I said, how come? He said he just didn't believe in vaccines. And there's also that guilt, right? Why did I not get vaccinated? Why did I not get my parents vaccinated? I mean, there's no end to this. This is going to be a long saga that's going to stay with us for a long time.
Yeah. Talking about vaccines, there's a talk saying that post the frontline workers, would it have made sense to target 15 to 25-year-old first for the vaccine, as they tend to socialize more, and it would have helped the students to go back to schools and colleges? Is that a right way of looking at it?
You mean in terms of whether we should vaccinate young people?
Yeah.
I would not.
Before you vaccinate the, post 25. So.
No, it was a political move. It was had nothing to do with science. Because vaccination mostly is about protecting people, first of all. And the people at risk are about the age of 40. So we published a large study in Science, which is the leading science journal last year, from over 700,000 people in Tamil Nadu and Andhra Pradesh. And the mortality is highest. Remember, your chance of dying of COVID is about 10x greater if you're between the age of 40 to 50, and then doubles for every age group, right? But 30 to 40 to 40 to 50, that jump is pretty significant, right? So it jumps about 8x. Vaccinating anyone below the age of 40 just does not make sense when you don't have enough vaccines, and we don't have enough vaccines by a long shot. So it would have made sense to first focus and get all the people above the age of 40 or 50 vaccinated first, because also they're a smaller proportion of the population. The under 35s in our country form about 65% of the population. Why take on that bunch when you haven't vaccinated the 35% who are in the older age group? So this has, like many other decisions, have nothing to do with science.
Okay. Again, with all the shortages of vaccines in India, do you think getting everyone vaccinated is a long-term solution? So if yes, what is the short-term remedy for us? Because every day we hear about the shortage of vaccines, so there's a long queue of people waiting for it.
Well, you folks are all in business, and you know that if you don't do your procurement in advance, you don't have the supply, and India didn't do the procurement. That's as simple as that. And India will not be able to solve this problem for another 2 years, given the current rate of vaccination. And even with the scale up, it will take us a while. It'll take us a while. So this is just short-sightedness where October, November of last year, same issue as with lack of oxygen. Why is there no oxygen? Because nobody planned for it. And why is there not enough vaccine? Because nobody planned for it. And I wouldn't blame the vaccine manufacturers, because we don't elect vaccine manufacturers. We elect governments to do the job.
So in the short term, what is the solution then?
There's none. We can import vaccines, but many of the mRNA vaccines are difficult to keep on the cold chain in India. We don't have the cold chain in India for a minus 70 or minus 50 degree vaccine. So until the vaccine production increases, which is going to take some time, there really isn't a solution.
So again, on the question of vaccine, we hear people talk about one vaccine being better than the other. More so people are inclined towards Covaxin as compared to Covishield. Is there really a difference between the vaccines, or is it again a gimmick?
See, phase 1 data for Covaxin showed lower side effects than Covishield, and that's anecdotally true as well. So Covaxin just has lower side effects, but efficacy-wise, they're pretty similar.
It's the same. And again, is this a myth saying that once you've had the 2 shots, the vaccine will break the chain and is not variant dependent? I know there are different conversations around that.
The honest answer is we really don't know. We just don't know
yet. Okay. Dr. Raman, the other question that's being asked is, do you think that there are treatments emerging that are superfluous or having damaging side effects? The latest word, I've never heard of this before. I'm not sure if I can pronounce it right. Mucormycosis, the fungal disease, is supposed to be the new phobia. Also, there is this plasma treatment, there is HCQ. So what is happening? What is right? What is wrong? Is there a scientific reasoning behind these, or from a doctor's perspective, what do you think is happening here?
So first of all, I'm not a medical doctor. I'm an epidemiologist. So we studied this.
Yes.
Let me just tell you that the scientific literature on these medications is pretty well established. That's number one. Number two, the treatment in India, for the most part, is pretty irrational because the guidelines themselves are pretty irrational. Generally, so hydrochloroquine was never efficacious. This was, again, one of those myths in the early stages that was promoted. India exported a whole bunch of useless stuff, and it was never going to be efficacious, and it is just not worth taking. And there's now at least 30 trials that show it's not worthwhile. So hydrochloroquine, you can throw that aside. Plasma therapy, even today, it's on clinical guidelines as what is called, you can do it if you want to, kind of a not recommended list. But that seems to indicate that it has blessings to say use it if you want to. But the government's own trial on plasma therapy showed that it had no effect at all. So when someone comes to me begging for plasma, I'm like, why do you waste your money on this? You might as well drink cow urine because it has the same effect. Right? So at least you'll make some people happy. So, plasma is really not, there's no benefit at all. In fact, there's some consequences which are negative, which you might generate some new variants because of plasma therapy as well. That's possible. Then let's take dexamethasone and steroids, corticosteroids. These are usually not indicated early in treatment because in the first stage, you generally let the body fight the infection, and that's really the way. Remember, the most important force fighting the infection is your own immune response. And you have to let the body's immune response fight. And our guidelines often call for early administration of steroids, which is a big mistake because you're effectively not letting the body fight the infection. And so steroids really are not given in other parts of the world in that early phase. And usually drugs like remdesivir would not be given till much later on. Now, when I've not had COVID, but when a close friend of mine had COVID and he gave me his prescription for 15 drugs or 16 drugs, he'd just been tested COVID positive, nothing, no symptoms. I was just shocked. This is from a reputed hospital in Delhi, so-called reputed hospital in Delhi, and 15 drugs, most of them were completely useless. But you have to remember, every medication has a side effect. You never want to take on that side effect unless that medicine is doing something for you. So all of this irrational treatment is really causing serious damage again. And, I don't know what to say. I mean, I don't mean to create panic in your group, but basically to say, find a trustworthy GP that you can really trust. Feel free to get a second opinion. If anyone's giving you more than, if you went to the best doctors who deal with this stuff, they will say, take a paracetamol or fever reducer, and that's all you really need. That's all you really need. And let your body fight off the infection. If it starts getting worse, then call in some reinforcements. But in the early stage, please don't take this, 15 drug package of Zincoid and Fabiflu and this, that, and the other. It's just not indicated at all.
That must be a big relief for most of them in the session today. Again, it is evident that we were caught unawares during the second wave due to the sheer ferocity of the virus. Now there's a prediction of the third wave. So what should India do to be better prepared this time?
So let me correct. It is not the ferocity of the virus. The virus was as ferocious last year as this year. It is our own stupidity. So the reason why we have a worse wave this year has nothing to do with the ferocity of the virus. The wave's ferocity has to do with the fact that we allowed mass gatherings, that we had weddings. 3 weeks ago when Delhi had a lockdown, there was an exception for weddings. You could get a wedding pass and go to a wedding. I'm like, what's the logic here? The entire city is in lockdown, but somehow you can go to a wedding. This ferocity is entirely driven by our own stupidity. As individuals and as a society, that is all there is. The virus is no different, and that's why people ask about strains and say it seems so much worse this year. It is worse this year because we've allowed it to get out of control. So that's all it is. And this third wave will happen, and how it happens is entirely determined by us, 100%. If we let our guard down, if we continue to think, oh, it's happening only over there, Mumbai is better, let's start moving around, all of this stuff, until everyone is vaccinated or has had the disease, we are not out of the woods. And that's the only thing to remember. There's no other, I don't know how else to put it. There's not a good news to say, guys, you can go out when this wave is over. If you go out when the wave is over, it's going to come back. That's all there is.
With regards to lockdown, there were conflicting messages from you. Initially, you had mentioned that that's the best way to do it. And then there was another thing where, as you rightly said, they could have a negative impact on the economy as well. So do you see that happening again, or are there other ways of human behavioral changes so you don't need to have as much of a lockdown going forward?
See, last year what happened was with Barka, in fact, that interview is right here in front of me, and it was, and with Karan, I had asked for the lockdown simply because we didn't have the data on where the virus actually was. And without the data, I was worried that in a country with very weak health systems like India, it would just rip through in no time. And I'd written in the New York Times, the New Yorker, all at the same time, basically about the same thing. And I would have preferred that we had done state-level lockdowns at that point in time if we had had better information. But we had very little information because testing was highly restricted also at that point in time. And that's why at this time, I don't think we should really do a national lockdown because it has economic consequences. But we should do very localized lockdowns and very thoughtful lockdowns in advance. Now, whether that will happen remains to be seen. But I don't know if a national lockdown is really the right answer. We do need restrictions, and always just keep in mind what I said earlier. You need the restriction before the wave starts. If you do the restriction after the wave has really started, it's too late. So you have to start it when you see the numbers ticking up. And some places are having devastating epidemics like in UP and Bihar because they don't test that much. And when they don't test that much, they have no visibility into the pandemic. And when you don't have visibility, you suffer in terms of health because people need to see the caseload rising in order to protect themselves. And I'll give you an example. With HIV, in HIV, different countries have different approaches. And India, by the way, did very well on HIV. Uganda, Thailand were countries that spoke openly about HIV and said people are dying of HIV/AIDS. It's sexually transmitted. So protect yourself, wear a condom, don't have more than one partner. They spoke about it openly. They got rid of the HIV problem much faster than countries like Malawi, Botswana, South Africa that didn't test, didn't talk about it, and they had raging epidemics for much longer periods of time. So the most powerful tool that you have is really information, because you tell people this is what happens, you show them those cremation grounds and those hospitals, people will self-protect on their own. You don't even need a lockdown.
It's true. I'm just going to take two questions from the audience. This is from Monisha. She says, I read every day that oxygen tanks arrive every day at our airport, but are not cleared by customs. Are you working on expediting the distribution system?
No, we're only working on the last mile delivery and then a number of cities. We're not working in Mumbai, by the way. We're working in a number of other cities to make sure that because oxygen is available, but this last mile of getting to patients is a problem, and triaging is a problem. And we solved the triaging problem because, and we focused on that, other people are solving other parts of it, is because the thing that is in short supply is actually critical care bed capacity. Today, a patient doesn't want to get out of the bed and go home, and the doctor doesn't want them to do it because there's no reliable oxygen for them at home. If we can solve that problem by making sure there's reliable oxygen for them at home, we can turn over the beds much faster. And if we can, today the bed turnover is happening largely because of deaths. It's not happening because of people going home with oxygen. If we can do that, then we can have more access to critical care, because in the short term, you can't expand the number of critical care beds vastly. Now, with respect to oxygen arriving, I don't know where it's coming in from, but certainly you have to remember it's improving in the hospitals for sure. But of every one person who's in a hospital bed, there are probably 10 or 15 people waiting outside, waiting to get into that hospital bed. So we're trying to solve the problem for those people.
Okay. There's one more question. This is from Usha. She says, when do you think India can comfortably get to a point of opening up things to what it was prior to the second wave?
Well, we should not do that. That's what got us into the second wave. So I don't think that that's really what we should be doing at all. I think we should be expediting our vaccination and putting pressure on government to increase vaccine production. That's really the only way out.
So going forward, Dr. Ramanan, what next globally in general and India in particular? So how do you see the healthcare space changing, infrastructure, support system, etc., being more effective on a long-term basis?
I don't know. I mean, I'm quite disappointed that after all of the warnings of last year and all of the lockdown of last year, that we've been so unprepared this year in every front. I mean, this is the worst epidemic in recorded human history as far as excess mortality goes. Remember, in 1918, the excess mortality was not large as a delta because there's a lot of deaths already in 1918, and so the delta was not as much. For us, we live in a much healthier age, so our excess mortality for COVID vastly exceeds that of any other disease. In the US, for instance, it's the third biggest killer last year after, I think, cardiovascular disease and cancer. If we have not learned from that to put this in place, I'm not, I think I would look to people like you to say, what are you folks doing to solve this problem at a scale that, a few people with, we might have $10 or $20 million, but that's not really what's going to fix the problem. It's going to take industry putting pressure on government to say we need a good health system, because if you don't have a good health system, you don't have a workforce that can focus on working. You can't have a productive economy, and I don't know if we've learned that lesson.
So you've seen this happening globally. So what are some of the best lessons learned that can be passed on to some of the countries too?
I think the lessons are more of the negative kind, which is ignore COVID. I think that's what to learn from India, which is don't deal with it the way India has. And now we're working with Nigeria and other countries to see how they can avoid this medical oxygen problem there. I think fundamentally the problem is that we take health for granted until it's in danger, and that's true for all of us. Right? We take it for granted, and these are long-term investments that I don't know if there's a best practice per se, but we should invest in science. We should invest in better, capacity for our systems to be able to respond. We should look at early detection. Other countries do that. We just don't on early virus detection. We don't invest in research on One Health research, understanding that these jump from animals to humans. All of these are things that I hope we can look at other countries that do it well and see it. And at the end of the day, I'll tell you, I remember the Singapore foreign minister said this early last February, and he said the countries what COVID is going to test of countries are three things. It's going to test the health system, it's going to test the governance capability, and third, it's going to test society in terms of how much society is able to work together in order to solve a problem. And in the US, they had a health system, but they didn't have the governance in the previous administration. But they did have some society, although society was, some states worked and some states it did not work. In India, for a period we had the governance, we didn't have the health system, but we lacked the society. We don't have the society, cohesive in the way that Singapore and all have, or East Asia. The reason East Asia has escaped much of the pandemic is because they have all of those three.
Okay. True. So in terms of policies, that's another area that you are actively involved in. So is FLO. So if there are some policy changes that you think that we need to look into for better healthcare and long-term solutions, are there a few that you can list out?
Well, I think we need to invest in this. We need to invest in the space. I also think that this is a space which should be owned in a collective sense, where there's good technical advice, where it's not passed through a filter of politics or anything else. The US has the advantage of having systems like the NIH.
Sunita, can you mute yourself, please?
Yeah. Sunita, can you please mute yourself?
Sorry.
Yeah. So there are, there are independent institutions that seek to power no matter what, and I think that we don't have the technology that can do this. Where we failed is largely on the science, on proper guidance, on scaling up testing. Remember, India is not Africa. India has enormous capabilities. It has enormous scientific capabilities also. It really is a country that it should have done so much better. And so it is not for lack of people and capability. We just don't have the institutions that exist to be able to deliver this. And I think if this is not going to happen out of government, it's for industry and civil society to put together.
So there's one. There are three more questions from the audience, if you don't mind. Back to the basics. There's a question saying, how does COVID actually spread? Is it airborne, waterborne, or through pipes in apartment buildings?
To be honest, we only know about the airborne route. We don't really know of any other route. Which is not to say that there might not be small transmission happening through other ways, but these are not predominant. It does transmit the most within the home. That's because people within the home interact with each other a lot. So it's a 1 in 10 chance of transmitting to someone within your house. It's only a 1 in 40 chance of transmitting to someone in society, in the community.
Okay. The next question is, COVID-19 situation going to make us more self-reliant as countries, or will there be a spate of strategic alliances to grab evolving market shares?
If you're talking about vaccines, I think India has let the world down on vaccines. It has helped a lot last year. And, some people disagree with that and say, oh, but India should not have helped these countries. I disagree with that a little bit. I think it's good to be been seen as someone who helped, although while we're doing that chest thumping, we should have also been increasing supply. The problem was not in helping other countries. It was not increasing the supply while also helping other people. That was the problem. But I think there is a sense that countries will go into their own shell. I mean, when Angela Merkel says, if we cannot rely on India for our vaccines, then maybe we should look into our own production capacities. So I think when the dust does settle, I think you're going to see countries investing in things like vaccines and medicines on their own and not relying on global supply chains as much, because they've realized that when things turn south, it doesn't really work out for them. So for a pharmaceutical manufacturer like India, it's not going to be in our best interest the way things have happened for COVID.
Okay. There's one question from Kiran Gera. She's our past president. She says, please give us 3 action plans you would advocate today if you were asked by those who control.
I don't know. I talk to people who control all the time, so it's not that easy. So, remember, these are not, it's not like everything would happen. I think what we really should do right now is we should increase our vaccine capacity immediately. And I think we should go on a war footing to vaccinate everyone. In fact, someone asked me this about what the world should do. This is a global this is a global pandemic. If we had to pull out the military of all of the top countries and go out and vaccinate everybody in Africa and India and everywhere else, that's what we should do. We should do this on a war footing. Literally, I mean a war footing. So first step, I would go out and vaccinate at a scale which is unprecedented ever. The second thing I would do is, until that happens, to be able to allow information to flow and not cap information flow, so that you allow people to self-protect until that such time happens. And I think the third thing that I would do is really, go back and question our medical guidance and treatment, because I think that's something which needs to be far more rationalized in line with what the global evidence is, and make sure that all treatment is very aligned with this. Sorry. So I think I would pick those three, but above those three, the top one I would do is medical oxygen, because that's what's killing people right now. And I think medical oxygen is the number one thing to solve for ourselves, because this has been found in every country around the world. We had, again, last March, I had talked about ventilators, and I'd said, why aren't we manufacturing ventilators? And as it happens, I had assumed that we have the oxygen, because that's why I was calling for the ventilators. Ventilators require oxygen. And I should have thought to think, okay, we don't even have the oxygen. What are we talking about ventilators? And get the oxygen first, and then the ventilators. And remember, at that time, Mahindra went and tried to fix a ventilator with auto parts, and everyone did. But we didn't solve the oxygen problem. And that was a huge mistake, and we need to figure that out ASAP. So again, oxygenforindia.org is where we're focusing a lot of efforts, and other NGOs are working there as well.
One last question, and I'll let you go. You spoke about information flow, but if you look at the media, they seem to be pushing one specific agenda or the other, and a lot of it driven more by sentiments than logic. So how is this affecting the fabric of the society?
I don't have a TV, and I don't actually pay a whole lot of attention to media, so I really don't know what's going on out there. Of course, I used to do the Indian channels, but sometimes it's just I don't pay a lot of attention there. But I can understand that there's concern and panic, and this is a fine balance between communicating seriousness, but also not putting people into panic, because not everyone has the capacity to handle information and risk. And this is a problem for us, not just in India, but in many other countries, because calibrating risk is very hard, right? So if I were to ask you to cross a road in Mumbai, what is the chance that you might get hit? And would you cross the road against the light? You have a fairly good idea, because that's something which you've grown up with. You have that risk. And if it comes to COVID, you don't have that, because it's new. It's a new risk. We haven't calibrated to that. So if people are worried, I totally understand that. But that's what we're forced to deal with. And maybe next time we should plan for these in advance.
I think the one thing that I personally learned is that you've got to get ahead of the curve. Don't try to deny it and put your head in the sand and wish for the best. These are the times when the behavior of each individual gets tested. So really sorry for your loss, Dr. Ramanan, and really, really appreciate the time that you gave us today. It was a very fruitful session for all of us. And again, this is not just a webinar, but it's the starting to a partnership with you. And I'm sure we would love to work with you on a long-term basis as well. Thank you very much. And I'm going to hand it over to Tamina to wrap up the session. Thank you so much.
Thanks, Abby.
Tamina?
Yeah. Thank you, Maloo. And a very good evening to all. The pandemic continues to be an incredible teacher. This time, evoking the spirit of Ubuntu. This is a Zulu phrase, and that means, I am because you are. Thank you, Dr. Ramanan. FLO Mumbai is extremely grateful to you for sparing your valuable time from your busy schedule, where you're doing your best in this harsh pandemic situation. The knowledge and the experience that you have shared was indeed an eye-opener. Thank you, Maloo, for moderating this talk show brilliantly. FLO members for joining in today. And thank you and have a great day. Over to you, Labaina.
Thank you, Doctor. Thank you for being here.
Thanks for having me.
And I will be in touch with you for the program that we can try and tie up for raising funds. We've already posted the link on our groups and asking for members to contribute.
No, I appreciate that. I would wait if FICCI FLO could go after at least making sure that no woman dies because of lack of medical oxygen, and that's what we're solving for now, which is beyond the pandemic. We've got to make sure we solve this, forever. We just can't have this happen again. Thank you.
Thank you, Doctor. Thank you. Thank you for being there.
Bye.
Thank you.
All right.
Bye.
Bye.
Thank you. Bye.